Minnesota is at a critical healthcare crossroads and the nation is watching. We are leading the country with a comprehensive preventative approach to preventing obesity and tobacco use and exposure. The progression of obesity in the United States since 1983, a stark reminder of how much work there is to be done with this healthcare epidemic. In Becker, Clay, Ottertail, and Wilkin counties, SHIP is concentrating our efforts on making policy, systems, and environmental changes in the pilot cities of Detroit Lakes, Dilworth, Perham, and Breckenridge. We're impacting schools, cities, work sites, and healthcare settings with the help of community leaders from our region. Thousands of students walked to school on International Walk to School Day on October 6th in Perham, Detroit Lakes, Dilworth, and Breckenridge, joining millions around the globe to enhance the health of kids. This strategic event is one step towards encouraging a cultural shift where kids can get some of their exercise by merely walking or biking to and from school. School districts are considering new bus stops so students walk further and to reduce congestion. And several schools have ongoing walking school buses led by trained leaders who walk the students to school in a safe manner. Here's a walking school bus program at the Detroit Lakes Rossman Elementary. Children consume 2/3 of their daily calories while at school through breakfast, lunch, and snack programs. School districts have an obligation to protect children's health and be a leader in shaping the future health of our young people. SHIP is working directly with schools to strengthen and improve school wellness policies and food practices.
Without SHIP, we probably wouldn't have looked at policies and what we're doing for kids, especially in the area of, as we focus on academic achievement. We find that through our research with our partnership with SHIP, that academic achievement improves when we incorporate physical activity. We're also looking at things relative to our menus so that we are focusing more on wellness type nutrition-based meals. And so with that, without SHIP, those things probably would not have happened.
SHIP is working closely with school districts to implement comprehensive wellness policies that include healthy eating and increased physical activity. Here are examples of what Perham has done.
Probably from the administration level, the most exciting thing, though, is that our school board has adopted one of the most comprehensive wellness policies in the nation. And that wellness policy is what we go back to every time to make improvements in the system.
My name is Danny Nelson. I'm in 8th grade and I'm a student council member. And I'm standing in this machine because student council helped sponsor it and we helped the ideas and sometimes we'll help run it. And I think it works really well because kids after school can grab a snack quick and run off to the bus, or if you're in after school sports, I know I like grabbing something from here because it's faster than going to Subway and it's not as filling, so it's a lot better to just eat here and be able to get it done with. So
there is clear evidence that increased physical activity is linked to an increase in on-task behavior and academic achievement. Perham has been on the forefront of integrating activity breaks through the school days to improve opportunities for physical activity. Integrating physical activity into your daily routine, like walking or biking to work or to the grocery store, is one of the most effective ways to protect your health. SHIP is working closely with city officials to bring about the benefits of improved community design and make commitments toward such environmental changes. One example is Perham's revitalizing the Cal Miller bike path.
One of the long-standing goals of the park board was the ability to revise the Cal Miller bike path. Through the efforts of SHIP and the grant that they have available, this goal is now becoming a reality.
I joined the Active Living Committee to have some input for the disabled people in the area and getting some health improvement for them also.
The City of Detroit Lakes is also working with our local school district on the Safe Routes to School grant program, and so we're hoping that that can come to fruition here in Detroit Lakes, because that'll be another big boost for our infrastructure and for our students to have the ability to walk or bike to school every day.
SHIP is providing guidance to employers and worksite wellness committees in an effort to reduce healthcare costs and to increase employee wellness. One way this is being accomplished is through promoting access to healthy foods at the worksite. Healthcare institutions are key to the success of health improvements in Minnesota. Healthcare providers have a unique opportunity to approach prevention and intervention strategies for obesity and tobacco use and exposure. In our region, 14 healthcare partners are doing just that. They include medical clinics, public health settings, and a physical therapy clinic.
The SHIP program in Minnesota has helped us to implement taking some height and weight and calculating BMI measurements that we weren't doing prior to that. And what that has now helped us to do is discuss with our patients how this can affect their overall healing and affect their injury, so that we can have a quicker recovery time. And the overall wellness, we've also incorporated discussing tobacco use with our patients too, with the Minnesota Quit line. And without SHIP, we really wouldn't have been able to implement all of these, and definitely not implement them in such a short time.
And so I think it's important, the work that SHIP is doing in our community. What we're trying to do is promote healthy living, healthy eating, exercise, whatever it is that because rather than our society have to pay for disease treatment, we hope that someday we can say that we're paying for the disease prevention. And what that does obviously is raise the quality of life for everyone overall, and also lowers our costs much, much more.
We owe it to our citizens, especially the next generation, to make critical changes to help save money and lives. For more information, contact Jason Bergstrand from the statewide Health Improvement Program at 218-998-8349.